Today I would like to clarify some of the muscle actions involving the scapula and the shoulder joint. These include elevation, depression, protraction, retraction, and medial and lateral rotation. Let's take a look at the muscles of elevation. First, levator scapulae. Levator scapulae goes from the cervical spine down to the scapula. So when this muscle contracts, it will pull the scapula up into elevation. Second, trapezius. The superior fibers of trapezius attach the skull to the scapula. So when this area contracts, again, it will pull the scapula into elevation. Lastly, rhomboid major and rhomboid minor. You see how these muscles attach diagonally from the spine down to the scapula. So when they contract, it'll pull the scapula up into elevation. Pectoralis minor, which goes from the ribs to the coracoid process of the scapula, will contract and pull the scapula into depression as well as forward into protraction. However, the main muscle of protraction is serratus anterior, which attaches on ribs 1 through 8 and then goes beneath the scapula to insert on its medial border, which will contract and pull the scapula into protraction. The muscles of retraction are actually similar to the muscles of elevation, which would be rhomboids major and minor and the medial fibers of trapezius. So these muscles would contract and pull the scapula back into place. Two majors and a mus insert into the intertubercular groove. This would be pectoralis major, teres major, and latissimus dorsi, and these produce medial rotation. Pectoralis major inserts beneath the deltoid in the intertubercular groove, and because of the angle that it comes across the shoulder, it's going to pull the shoulder into medial rotation. Teres major attaches to the lateral border of the scapula, then sneaks around the medial side of the humerus to attach to the greater tubercle in order to pull it into medial rotation. Similarly, latissimus dorsi originates down here-ish, then sneaks up, attaches to the greater tubercle to pull it into medial rotation. Two muscles that produce lateral rotation of the shoulder joint are infraspinatus, coming from the infraspinous fossa, and teres minor, coming from the lateral border. These both swoop around the outside of the humerus to attach to the greater tubercle, and because of this angle, they are able to laterally rotate the humerus. There you have it! Elevation, depression, protraction, retraction, and medial and lateral rotation.